awareness and help caregivers and empower other caregivers, and of course create awareness for Alzheimer's and dementia. But anytime you want me on a panel like this to talk and to whatever, I am 100% down, always.
What do you think, Betsy?
Betsy.
Should I stop the recording? I pressed.
No.
Yeah, I just do this so I can remember, you know, or maybe to do, I think maybe down the road, if you got a couple of more people and had like a panel and just talk about different things that are happening, or, you know, something that you heard of that could be available to you. Just like for us in the state of Massachusetts, they just passed a law for doctors, physician assistants, nurses have to be trained in the diagnosis and treatment of Alzheimer's.
Good.
So
absolutely, that's a step in the right direction.
So for our state here, apparently this is the first state that's doing it. You know, Massachusetts decide rather than waiting for the government to decide something, it's to take matters into their hands, because there is a complaint that it takes well over a year for anyone to get some sort of a diagnosis.
Right, and not only that, you have to remember that most people with Alzheimer's, well, with dementia and Alzheimer's, that diagnosis usually comes so much later than when those symptoms start becoming present. And so people are going 4 or 5 years without a diagnosis until they finally get to a point where family and friends are like, what the hell is happening here?
Right.
And then we start that ball. And then it's kind of too late. But that's kind of a funky line, because you can't force family members and people to bring people in early, you know? Well, so we have to educate them about those symptoms and prompt them to recognize those and act accordingly. Because if healthcare is going to do their part, then we have to do our part.
Correct. I will talking to someone today, and you know, because there's been quite a few cases of early onset. They're not the typical age. They're in their late 40s or 50s.
Yeah.
Amen, sister.
There's Matt, right?
That's right. You know what? It is so frustrating when you know something is wrong and the doctors refuse to listen, and then the bitch, excuse my language, neuropsychologist accuses you of not complying.
Yeah.
I mean, she needed to go back to school, but I didn't know 8 years ago what I know now.
Right.
Right, and that's important. But I think, you know, like for us in the state of Massachusetts, they're going to take care, you know, they're going to try it. And it's going to be like a trial error for them to figure out, you know, how to train these doctors and nurses.
Well, you know, there's healthcare. It's such a mess, and it's frustrating. I had Elaine Rusk. Betsy, you know Elaine Rusk.
Yes.
Yes, her father, she's in Attleboro, and she took care of her dad for a very, very, very long time. And the last, 4 years he was housebound, she was housebound. And I'm going to tell you this is what I was completely disgusted with. So awesome, Massachusetts, that you guys are doing that. I think that's great. However, within the Attleboro area, Elaine, I think she contacted 4 or 5 different home care agencies for caregivers and hospices. And multiple times her dad was a Hoyer lift, and multiple times she was sent caregivers, if not most caregivers, actually even entire agencies had said that they did not have an aide or caregiver skilled to do a Hoyer lift to get her father out of bed. And pardon my French, but what the flying fuck? That makes me enraged. How do you charge people for this care and not have skilled caregivers?
Exactly.
Most states need to do better. Massachusetts and Washington State too. I live here,
all
and
all the states have.
I'm disgusted, continually disgusted.
Well, the more
I
you
had to work a Warrior lift when I was 16. That's going way back, girl.
Rain, it's just, but why is that not part of their training? I mean, what's happening here that it's become acceptable that we only train people 75 hours and do a background check and fingerprint them, and then they're free to go out into the community and provide care. How is that acceptable?
Well, these are the things you talk about, and and we put it up. You put it out there.
Exactly.
You have to keep putting it out there for people to realize. But I think the community has really dropped the ball.
Oh, completely. And it's all profit based. And we have a metric now in hospice, and I understand why it's there. And most hospices, for people who don't know how hospice runs, most of it is Medicare funded. So we rely on and are, what's the word I'm looking for? We have to go by Medicare mandate.
You have compliances that you have to abide.
Right. So we have CMS if they want to, if we want to be reimbursed for the care that we provide, we have to prove it was done by Medicare mandates. And so at the end of the day, it tends to be in healthcare, what do we do for these people? How much did it cost us, and how much are we going to get back? Mm-hmm. And instead of it being revolving around the training and the education, that we need to provide that care. But hospice has a metric now that just was implemented countrywide, nationwide, that in the last 7 days of life, we have to have 2 visits from either a chaplain, a social worker, or an HHA, myself. Mm-hmm. And basically, it's ensuring that we are actually providing the care that we're saying we're providing at the end of life, right? Mm-hmm. And I understand why it's valuable. It holds us accountable, and I like that. But when it comes to end-of-life care and my schedule, it is extremely difficult sometimes to arrange those things, and especially when people are coming on hospice so late. We have families waiting so late until people are actively dying, and maybe we're only seeing them once before they pass. And that's not fair to the patient. They miss out on all of those beautiful services and things that we offer. So it's something that we're all struggling with. All hospices are struggling with making sure that we do those things. And I don't know, sometimes I just feel like, in my head when it first came up as a healthcare worker, I thought, this is just one more thing I have to keep track of.
Right, yes. Can I just ask you, though, when it comes to hospice, isn't it the doctor that decides when hospice is going to come in?
So at any time, you do have to have a doctor referral. You have to have a diagnosis that will lead you to 6 months or less to live. However, anybody who feels that they have a loved one approaching end of life can call hospice and ask for more education. And most hospices will work with you to work with your doctor to get that referral. And so we see people from all sides. When hospice first started, a lot of people just assumed, and there's still a misconception, that hospice is only for cancer patients. And that's just simply not the truth. It is for anybody who is approaching end of life, whether you have Alzheimer's and dementia, whether you have cancer, whether you have Parkinson's, whether you have ALS, whether you have Lewy body, whatever. You just have to be declining in order to be on hospice. There has to be weight loss, mobility loss, you know,
Yes.
all of those things.
Motor faculties.
Not necessarily.
Okay.
We have a lot of end of life Alzheimer's patients. We have a lot of them. Now, some hospices, not all hospices are nonprofit. Some of them are for-profit. Some of them only do outpatient and only have facilities in which critical patients go to, like ours do. Florida has a ton of hospice facilities that people go to at end of life, whereas here in the Seattle area, we have facilities that they are mainly for those patients who are in crisis, who need more medications and things than we can provide in home. Because there's only certain things that we can provide people in home. Whereas in a facility, a doctor, you know, we have access to a wider range of drugs to manage symptoms. So it's all different. So, but I know we have one hubber, Karen Meredith Williams. She took care of her dad for a very long time, and she's in Florida. And this is a man who I think he had frontal, right, Betsy? You know who I'm talking about? Oh, Betsy, maybe she can't hear me.
Betsy, oh, she's not here. Betsy?
Can't hear you, Bet.
I'd write her a chat, but I don't know if she would read it. Betsy?
No. I'll send her a message. So Karen, her dad was extremely mobile, right? Extremely walk.
Can you hear me?
I can hear you now.
Now we can hear you.
Yay!
I've been here.
So Karen's dad was extremely mobile and declining. But despite the fact that he was not eating, he was losing weight, and he was approaching end of life, he was extremely mobile. And she tried multiple times to bring hospice in. And she was denied every single time because he was too mobile. He didn't meet the criteria. And I remember being so frustrated with her, not with her personally, but I was feeling her frustration because I have definitely seen that with dementia and Alzheimer's, where literally people are dying, but their brains are not allowing their body to stop.
Okay.
And I just felt so bad for her because she was so hopeless, you know, she needed the help and she needed those resources, but every time she tried, hospice said no. So different hospices will take different patients and different hospices won't. You know, it just really is up to that hospice, even though we all operate by the same mandate.
You know what's strange? Can you hear me?
I can hear you 100%.
No, not you, Matt. Matt might be talking in the background. My mother-in-law, Matt's mom, had Alzheimer's.
Mm-hmm.
Facility. We were never offered hospice, but you're talking 16, 17, years ago. Mm-hmm. My dad, he had some kind of dementia. I don't know if it's Alzheimer's or vascular or both. He was in a nursing home. He had hospice the last 2 years of his life.
Mm-hmm.
So why was he offered hospice and my mother-in-law never was?
Well, so...
Well, they were both in bad shape, actually.
So think about it this way. Hospice has only been in the United States since 1970.
Oh, really?
That's really, truly not a long time. And so the stigma that we have here around death and the education that doctors are provided about hospice and what we do has grown tenfold in the last 16 years. So it very well could be, Betsy, that people just weren't educated. They didn't know it was an option. They didn't see it was necessary. And that's just a sign of the times for healthcare. Healthcare has grown leaps and bounds, but we still have a lot of education to do around end of life. And